Hi, I'm Dr. Adrienne Ulrich, audiologist and owner of Parkway Hearing, and I'm the host for the Healthy Hearing series. Thank you for joining us for our Pediatrics episode. Early hearing loss can cause significant emotional and developmental issues in children, including affecting their ability to develop critical social, speech, and language skills. In addition, some hearing issues in young children can be treated easily with no lasting harm to the child. But when left untreated, those same issues can cause permanent damage. In order to mitigate these negative effects, it's critical that parents, caretakers, and medical professionals all know the signs and protocols for addressing suspected hearing loss issues in young children. In the past, hearing issues in young children weren't usually identified until around age 2, when the child began missing speech and language milestones. Luckily, we're more proactive now. Here in Massachusetts, nearly every newborn baby is screened for hearing loss before they even leave the hospital. This is because we know that early intervention before age 6 months shows significantly better results. In essence, the sooner we diagnose pediatric hearing loss, the better the outcomes will be for the child. The early intervention greatly increases chances of a child fulfilling their full potential regardless of their hearing loss, something we can all agree is best for the Commonwealth and for children. With modern advances in therapies and medical technologies, the options for treating hearing loss in children are better and more integrated today than they ever have before. In this episode, we're going to talk through best practices for healthy hearing in children, important signs of hearing trouble to look out for, and options for treating pediatric hearing issues when they do occur. And how often in children does hearing loss occur? According to the CDC, 14.9% of ages 6 through 19-year-old children have hearing loss. It's estimated that 1 in every 1,000 babies are born with hearing loss. This is called a congenital hearing loss. Congenital just means born with it. What are the causes of hearing loss in children? More than 50% of all pediatric hearing loss is genetic. A third of the genetic hearing losses caused can be genetic syndromes such as Usher syndrome and Down syndrome. Genetic hearing loss also includes hearing loss passed down from a dominant or a recessive gene from one or both parents, respectively. 25% of hearing loss present at birth is the result of a non-genetic factor. This could include pregnancy complications, premature birth, maternal health issues during pregnancy, a nervous system or a brain disorder, or drug, alcohol, or tobacco use during pregnancy. 25% of congenital hearing loss has no known cause. Children also experience acquired hearing loss. This can be the result of many issues, including a perforated eardrum and infections like meningitis, measles, whooping cough, and mumps. Acquired children loss can also result in exposure to secondhand smoke, loud noise, untreated frequent ear infections, or serious head injuries. Transient hearing loss and ear infections, that's hearing loss that comes and goes and can be detrimental to early childhood development, causes interruptions in critical skill acquisition for children. This kind of loss is often caused by one very common pediatric issue, middle ear infections. Millions of young children in the U.S. experience ear infections each year. Have you ever wondered why ear infections are such an extremely common issue with young children, but you hardly ever hear about it in older people? That's all because of something called the eustachian tube. When we're born, the tube that runs from our ear to our upper throat is horizontal. This makes it very easy for fluid to get stuck swooshing around in this sideways cavity, causing ear infections for many children. As we get bigger, the tube starts to upwardly grow, like with the rest of us, allowing better drainage and solving the problem of almost everyone. But those early ear infections are generally pretty easy to treat. Most parents are familiar with the pink bubblegum flavored medicines, amoxicillin, which are used to cure these infections. Each individual infection is usually a fairly easy problem to solve with access to modern medicine. But if the ear infections happen frequently and are left untreated, they can actually cause cumulative damage to the bones, the eardrum, and the auditory nerve. This can result in permanent hearing loss. This is why it's so important to address each and every ear infection quickly and to ask your child's pediatrician about preventative treatment options if the infection is a recurring issue. Nowadays, we typically test for hearing loss within the first 48 hours of a child's life. In the U.S., 98% of our children are screened for hearing loss during infancy. This initial screening allows doctors to act quickly and run a full hearing test if the infant doesn't pass the screening. However, many children pass the initial screening but go on to develop issues later. That's why it's so important that parents and caregivers keep an eye out for signs of hearing issues and get in touch with the pediatricians right away if they have any concerns. One way to keep an eye out for hearing issues is by tracking speech and hearing milestones in your children. Another is by getting your child's hearing tested again after that initial newborn screening. All tests are non-invasive, safe, and painless. Many schools in Massachusetts hold hearing clinics where they have the children tested automatically, but the parents still need to keep a close eye out for unexpected issues. In addition to tracking key milestones, here are some signs of hearing loss to keep an eye out for. In babies, it's that they don't startle to loud sounds, that they don't turn to a source of a sound after about age 6 months, that they don't say a single word by 1 year, that they seem to hear some sounds but not others. If we're talking now about children, it's that their speech may be delayed, that their speech may be unclear, that they don't follow directions, that they're often mistaken for inattentive or misbehavior. This could be a partial or a complete hearing loss. Other signs are that they say, huh, or ask for more words to be repeated, or if they turn up the TV volume too loud. Modern advances in technology and healthcare have greatly improved the options we have for hearing health loss in young children. Today, there are options ranging from hearing aids modified for a small size and high activity levels for all children to cochlear implants for young children who can't be treated with traditional hearing aids. Hearing aid technology has advanced to where children's hearing aids can be synced with mobile devices and Bluetooth capabilities. In addition, we have telecoil technology that allows us to attach to FM transmitters to children's hearing aids. This allows the child's teacher to discreetly wear a microphone that transmits directly to the child's hearing aids in a classroom environment. Technologies like this help close the learning gap when children have hearing loss and they're facing it in group environments, while still allowing the child to have a typical schooling experience with their classmates. Treating hearing loss, especially in young children, isn't just about technology. Our hearing plays a key role in our ability to learn new information, and those abilities are compounded and compromised when a child has hearing loss. Additional hearing treatments can lead to the development of speech-language therapy in a classroom setting, and that can also help them catch up on any developmental delays that the loss has caused for them. Once they are fitted with hearing aids or cochlear implants, they're able to hear well enough to begin these additional therapies with a licensed speech therapist. Other options include sign language teachers and interpreters, and occupational therapists to help the child with their toolkit of skills for coping with hearing loss. Your pediatric audiologist can help connect you with these resources when the time comes. And I'd like to now introduce you to my guests today. My first guest here is William Toussaint. He is a patient of mine at my office at Parkway Hearing in West Roxbury, and he's been a patient of mine for a long time now. And I'd also like to introduce his mom, Vanita Toussaint, and she's here today to talk about her experience as a parent with a child with hearing loss. So I want to welcome you both to the show today. Thank you for coming. William, I wanted to start with you and talk a little bit about how long you've had hearing aids and what are your first memories of the experience of getting hearing aids?
Well, I've had hearing aids for probably roughly about 10 years. And my experience with first getting them, I still remember them quite well when I was about 6. And I'm not sure how we sort of got to the conclusion. I was a kid, so I wasn't really let in to that kind of stuff. But I just remember, at least my earliest memory is remembering going through the different colors of the hearing aids, and sort of I was like, oh, I want red, and my dad was like, no, you're gonna have the brown one. So that was kind of my earliest memory in doing the test, obviously. So yeah, that was pretty much the start of it.
What do you recall going back in time now to 6-year-old William?
Wow. I remember a lot more because I was much older than 6. William was diagnosed going into kindergarten. He started kindergarten at 6, and in August of that year, right before September, he had his annual physical, and he unfortunately didn't do well on the screening.
And this was at the doctor's office?
That was at the doctor's office. And we had prompted for questions. His pediatrician had known him since, pregnant, since I was in utero. He was in utero. And so it started a whole chain of events. She didn't diagnose. She wasn't qualified to do that. She was just a general pediatrician. But that went to the series of children's and Harvard Vanguard, and then we wanted another opinion because we couldn't believe, and so then we got down to Mass Eye and Ear, and the rest is pretty much history. But it was quite and it was shocking.
Had you suspected that William had some hearing loss before it was first prompted at the doctor's office?
Well, I knew we were going to ask at that visit because I don't know if I ever told you this, but I was trained as a reading specialist. Huh. So William did not follow any of the typical things that you would see in a child with hearing loss because he was oral. He was functioning. He was a reader. He was doing everything like any other child his age was doing, and then some. And so there were just, I guess it's like a mother's kind of intuition. Mm-hmm. There were a couple of little things that I said, there's not quite lining up. This isn't quite lining up. And one of the key things was that garbly speech that happens sometimes. Mm-hmm. And developmentally, at that age, they can grow out of some of it. Mm-hmm. And he was still holding on to a piece that I was like, he's 6, I think he should be out of that, but that was my training.
Right.
And so I said, I think I'm gonna ask the doctor about this. And she felt the same way. She was like, well, it's kind of on the cusp, he could be growing out, might be a little bit. And he's an only, so, he could have just taken a little longer to grow up, but it wasn't him taking a little longer. But it was that single thing of that speech wasn't coming in just like I thought it should have been. And after that, it just seemed like I started identifying more because then it was like, oh my gosh, like I started doing my assessment and I realized that he wasn't hearing certain things. But yeah, it was that little bit of intuition there, with some training. Yep.
That was helpful, yeah. Mm-hmm. And when you got to the point, do you remember when you were getting your first pair of hearing aids, what that experience was like for you?
Well, sort of taken after my dad. I did like tech, so these new pieces of technology, as the way he put it, were like bionic ears, and so it was in some ways cool for me. But because I was 6. And at that time, you do have a little bit of self-consciousness. And I was already in kindergarten in September. And so I did know that it was going to be different. And I was like, oh, what are my friends going to think about it? And stuff like that. And so there was a little bit of resistance, not in so much as wearing them, but as being around unfamiliar people with them. So, so it was a bit uncomfortable, but after getting used to it, and my friends, they were young at the time, so they were like, oh, this is cool, new phenomenon for them. And so it kind of just started rolling along well after that. So, yeah.
Were you the first in the classroom that had?
Oh, yeah. Actually, at the time, I was the first in that school to ever have
Wow.
Hearing aids. So it was the first for everyone in that building.
Wow. That's amazing. What a role model. I mean, really, yes.
Yeah.
And continues to this day. Where do you go to school now?
I go to Boston Latin School right now.
Wow.
And of course, they've had a couple hard of hearing / deaf students before, so they kind of got this whole system down. but yeah, even with some of my classmates that I've had in the past, it's almost like a norm. Like they sometimes even forget that I have hearing aids. So yeah.
Oh, that's incredible. So what do you think that your life would be like without your hearing aids? What impact has this device, these bionic ears, provided to you, do you think?
I would say that if I never had hearing aids, life would definitely be much more challenging. I don't know how I would have grown emotionally, because we can't go back in time and figure that out. But I might have been, I don't know, maybe a bit more insecure or something, because I wouldn't be able to hear everything, and I'd be wondering why I can't hear everything like everyone else. So I probably would have adjusted eventually, but yeah, so not having that big of a gap in hearing with the rest of my peers has been a big benefit.
Do the teachers in your school, are they all aware of your hearing loss? And what do they do to help you in the classroom?
Well, let me think. Well, they in the past, when I was younger, sometimes they might write more on the board or something like that, or maybe give me notes before the lesson, things like that. Nowadays, with the more fast pace of high school, there's not really that much hand holding, but with the skills that I gained while I was younger, it's been much easier to keep up with I guess the wolf pack.
Now, do some of your teachers use a microphone to communicate with you?
Yes, they all of them do, pretty much, yes.
And so they're wearing something on themselves that connects directly to the hearing
Yes.
aids? Can you talk a little bit about that, how that works?
So, they're always, so far, they've always been willing to wear them.
And what does that do for you when they have the device connected to your hearing aids?
It'll, so when I don't have it, I'll hear like everyone else. Depends on the distance, the volume will change. And so when they do have it, then not only do I have that audio distance thing going on, but I also have a microphone going directly. So it's almost in some ways like 2 times the amount of sound, which though it sounds like a lot, it's actually not really a lot, and you sort of get used to hearing the same amount of volume, roughly, no matter what distance the teacher is from you. So yeah, that's been very helpful.
Good, good. Benita, as the parent's perspective, what do you think, or what would you want to tell a parent that's just finding out that their child has hearing loss, or they're suspecting that there's hearing loss? If you could reach out to that person through the camera, what would you want to say to them?
Oh my, definitely don't delay. Do not delay. You know, I mean, if you sense something, there's no dumb or ignorant question. You go to your pediatrician, you know, follow through on that, because if you're sensing something, there's something. You know, what that something is, your pediatrician can help you figure that out. But definitely do that, and don't delay, because the language is developing all of that time, and the gap gets bigger, you know.
When it's untreated. Yep, I understand. And what about you as a role model for someone with hearing loss? And it's certainly not something that's defined you. You've excelled in so many aspects of your life, and I'm proud to be your audiologist and to know you. But if you could talk to a little one, what would you tell them in terms of, you know, their hearing health and what's important?
Well, I would tell them not to take this experience too personally in a negative way, but sort of build on it, because it can, having hearing aids, it can sort of make you stronger for other life experiences where you may be different from the rest of the crowd. So if you get used to this now, it'll set you up for the future as well. And also, like, don't be afraid to have assistance, you know, because I've noticed some people, they just don't like that feeling of having needing assistance with either their hearing or they're crippled, or, you know, the list goes on. So yeah, just don't be afraid to have that.
Oh, that's excellent. Well, I'd like to thank my guests today for coming on the show, and for my audience for watching our series today. My name is Dr. Adrienne Ulrich, and thank you for joining us.